welcome everyone to Envision the Future Paid Family and Medical Leave Edition. We are honored to have such an accomplished group of panelists with expertise in policy, program administration, design, and advocacy here with us today. And together we're going to explore the question, what could the policy implementation and impact look like in a future when everyone in the country has access to and is able to easily use paid family and medical leave programs? But first, let's start with some introductions and a little bit about Nava. I am Martelle Esposito. I use she and her pronouns, and I am the partnerships and evaluation lead at Nava. Nava is a public benefit corporation working to radically improve how our government serves people. We partner with government agencies to build digital services that are simple, effective, and accessible to all. And I focus on how Nava contributes to broader program dialogues in the programs we work with, advocacy through education about the dynamics between policy and implementation work that we do based on our experiences, and measuring the impact of Nava's work. I'm now going to pass it off to Kathleen for an introduction.
Thank you so much, Martelle. My name is Kathleen Romig. I'm the Director of Social Security and Disability Policy at the Center on Budget and Policy Priorities. And I also work on paid leave, of course. And that would be a really exciting way to add to the social insurance programs that we have in this country. And I am both a policy wonk, but I also have a lot of experience working in the government sector. I worked at the Social Security Administration for 8 years, and I worked on Capitol Hill at the Congressional Research Service for 4 years. And so I have a good sense of kind of how those different stakeholders fit into this conversation as well. And I'm looking forward to getting more into that when we talk.
Thanks so much, Kathleen. All right, Greg.
Hi there. My name is Greg Norfleet. I'm the Deputy Director for Operations for the Department of Family and Medical Leave here in Massachusetts. My pronouns are he, him. I was the third person hired in our department, and I've been serving as the business architect, overseeing people, process, and technology for the department. We launched our program on January 1st, 2021. And so far, we've paid out nearly $600 million in benefits programs to over 90,000 people who are experiencing a big life event. In the department, we look at that as these funds allowed people to actually experience that life event instead of having to worry about making ends meet. Really excited for the conversation today.
Thanks so much, Greg. Makaela, your turn.
Yeah, hi, I'm Makaela. My pronouns are she, her, and I'm a design lead at Nava, and I've been working with Greg on the paid leave program in Massachusetts since December of 2019. Helped build the employee experience and thinking about some other ways to help improve operations now. Yeah, super excited to be here.
Thanks so much, Makaela. And last but certainly not least, Tameka, who will also kick us off today with sharing more details about her story.
Hello, everyone. My name is Tamika Henry, and I am an advocate for paid family medical leave. I'm a member of the Voices of Workers and also an ambassador with Make It Work Nevada. I am a wife, I'm a mother. I have been a caretaker for my husband since he became disabled in 2006. He has an illness called, a chronic illness called gastroparesis. It often lands him in the hospital. And we had to fight for disability for him for years. And with him not working, I became the main caretaker for our home and breadwinner. And over the years, I have lost a countless amount of pay due to not being able to go to work. And so I'm often faced with the challenge of, do I take off work to care for my family, be it my husband and his illness, or my kids, 2 of which have asthma, or do I go to work and work for a paycheck? you know, to make sure that we maintain our livelihood. So throughout the years, it's been challenging. I've lost jobs because you have to make that decision. And I know that I'm not the only family that is faced with this. And so that's why this work is so important to me and to many Americans. Even during the pandemic, my family and I, myself and my daughters, we had COVID. And I was out of work for almost a month. And majority of that was without pay. And the most challenging times came when my daughter would look over to me and ask, are we gonna die? Because we were having such a hard time breathing and such a hard time just being. But in the back of my mind, I was thinking, I know that we have to be okay, but also, how am I gonna pay our bills? Because I didn't have the protections of a paid family leave plan. And so I advocate for this because I know how important it is for my family, and I know how important it is for other families, because you never know when you're gonna be faced with having to take care of a loved one, or when a loved one is going to have to miss time from work to care for you. And so I'm thankful for the opportunity to speak to you all today. And we just really have to create policies that is inclusive of all families in all situations, because we never know when we're gonna need it. I'm a bit emotional this morning or this afternoon, because I just lost a cousin who has had medical illnesses his entire life. And we just lost him about 3 hours ago. And so I apologize for my emotion, but this work is so very important and it needs to continue. And Americans and families, we just don't have time to wait for a comprehensive policy that protects everyone. Thank you.
Thank you so much, Tamika, and no need to apologize. We're very grateful that you've chosen to join us today, and know that it's very, very difficult time for you right now. And we're just very, we feel you.
Thank you.
So we're gonna reflect on Tamika's experience and throughout today, and we're also going to maybe think about how that experience could be different if we had the policies and the programs in place to support folks like Tamika and all of us through these life events that we experience. So I'd like to start off the discussion a little aspirational. Imagine that we just launched and implemented the last paid family medical leave program in the country. How do you feel right now? And what does the state of PFML look like in our country? Oh, I think
Sorry, I forgot to unmute. I can kick us off. And I'd like to start by just echoing one of the words that Tamika used in her powerful storytelling about being inclusive. I would imagine a policy that, unlike now, where some people are covered in a medical emergency. Some people have, if you're lucky enough to live in Massachusetts, you're covered by a great state program. If you're lucky enough to work for Microsoft, you have a great program at your employer. but there are huge, huge gaps in the systems that we have now. And what I would envision is a policy that protects everyone, whether you work for a big company or a small company, whether you work part-time or full-time, whether you're new on the job or you've been there for 20 years, whether you live in a blue state or a red state. And it would not only provide the cash that people need to replace the wages when they're not able to work, but it would also ensure that when they went back to work, they would still have a job and it would still be substantially the same job that they left. And so I would envision something that was as inclusive as we could possibly imagine, and inclusive also of the different reasons that people take leave. Like Tamika said, you know, I think often people picture new moms and new babies when they think of paid family and medical leave, but most people who take paid family and medical leave are doing it because they themselves are unable to work because of their own illnesses and their own medical conditions. And to do that and to care for family members, to make sure that we're including all kinds of different reasons that people aren't able to go to work.
Thank you, Kathleen.
So jumping in from Massachusetts, where paid family and medical leave is a reality, and we do have job protections in our program as well. I would say that as a government employee, I'm excited the program's been adopted across the country, but I'm also very aware that the work's just started. Getting the program passed and building a solution that meets those requirements are going to be huge accomplishments, but that's not where the work stops. The bills that you'll see passed, they're a list of stuff that you need to do to be compliant with the law, but that's really just the floor for what you can do in service delivery for benefit programs. And honestly, if you get past that floor at launch, you're doing really, really well. Historically, about 87% of government IT projects with a budget of over $6 million fail to launch for one reason or another. So realistically, what you're going to launch the day that something comes out, the day that paid family medical leave becomes a reality for the rest of the country, it's not going to be everything that you want it to be on day one. So, but now that you're live, you've got to stay committed to the vision of inclusivity and of trying to make the program better, more accessible over time. And you should really be focused, as in the government sense, of putting the structures in place to continually improve that service for your stakeholders.
Thank you, Greg. Do any of our other panelists want to chime in?
For me, being a grassroots advocate, it would be important. It would be important to me that all families and everyone knows that this protection exists for them. I would like there to be a campaign that that highlights and shares like where we have been, where have we come from, and where we're going to. Like, you are now protected by this plan. I would hope that it's one that's inclusive, one that's equitable, and just making sure that they know about it. I think that, not even think, I know that it would impact the lives of so many, and where people won't have to choose their jobs and their livelihood over caring for their loved ones. I'm very optimistic. I know that there will be more homeowners. There'll be a stronger workforce because these protections would now exist.
Thank you, Tamika. Makaela, do you have anything to add?
Yeah, I mean, I think just echoing all of this, you know, I hope that when this program finally happens, it's something that people are really proud of. And like Kathleen said, like it's not just like this like kind of mediocre legislation. Like, it's something that is like really strong, really stable, really expanding benefits to everyone, and is also kind of built to acknowledge that applicants are under a lot of stress, even if it's kind of joyous stress, you know, of welcoming a new child. I think like I'm hoping that the program is really built for lived experience. And I think one of the ways I hope we're getting to that outcome is by actually involving the communities that have been most impacted by this. and the government's really actually seeking their input and giving them decision-making power to make this the most equitable program it can be.
Thanks, Makaela. I'm going to turn the questioning now to Greg in particular, so that we can dive a little bit into some implementation success and maybe what we can learn from that. So Greg, you built the first digitally native program for the state of Massachusetts, or in other words, the first program that was designed and built for and in the digital age from its inception. You did this with great success, as you shared that I think it was $600 million has gone to 90,000 people so far in a very short time period. What are you most proud of rolling out this paid family medical leave program that was no small feat?
Well, I didn't do it. Our team did it. And I mean, it's a combination of our vendors, our state employees, our other state offices, as well as other states that have PFML programs have been really active in helping us understand how do you actually get one of these things off the ground. You mentioned the phrase digitally native. This is something that we've been saying around the department for a few years now, that we're the first public benefits program that's been passed since the birth of the internet, and we should act like it. Our vision has always been to create a constituent-centered government service that leverages modern tools and processes to provide an experience that improves over time. When we started off, I was the third person hired, so we were a three-person office on a tight timeline. We had 30 months from bill passage to actually launching the thing. We served 3.7 million people, employees in the state, and 225,000 employers across the state as well. The team that is delivering this program is much larger, like I mentioned. It involves, it's grown over time, and it's not all folks that are directly working for DFML. There are vendor partners, there are stakeholders, the advocate community that's still involved today, and still giving us feedback on what's working and what's not working, so that we can target our improvements to make this program easier to access over time. I think, you know, PFML is something that's really easy to get excited about. It's a program that's absolutely worth fighting for, and we built the team to deliver on the promises of the law. I'm endlessly proud of the people that we put together on this team, because even though we've launched the program, we're still obsessed with making it more efficient, accessible, and easy to use over time. It's a culture thing within the department at this point. We call it constructive dissatisfaction in DFML. And it just means that you're continuously looking for ways to improve the service that's above and beyond just good enough. And I'm really psyched because our team really lives up to that.
I love that term, constructive dissatisfaction. Along these same lines, what is a recommendation you would make to a state who has just passed their first PFML policy and is getting ready to implement? It sounds like there's a lot of people to engage in your team, a lot of stakeholders to navigate. So yeah, what would you recommend to someone who's just beginning this journey?
I mean, first, you know, be optimistic about your chances. You know, like we came in, I don't think that we knew how big of a challenge it was really going to be. And I think that really helped us. Coming in and thinking that you can do it is going to make a lot of difference. But the other part is really focus on supporting and not replacing what's already out there. Remember that you're building for a diverse set of stakeholders, all of whom have legitimate needs in your program. And I particularly want to call out the role of employers, because it's something to think about. That oftentimes you think about the impact of paid family and medical leave on families, which is absolutely transformational. It also has a really big impact on the labor market and on employers themselves. You should really engage with employers early on, because they will have a lot of questions about how this will work for them. And they're also the primary way that employees get information about benefits programs or about benefits that could be available to them. Employers, more often than not, are responsible for remitting taxes to pay for the program. At least in our system or in our program, employers file taxes quarterly in order to create the trust fund to be able to pay the benefits. So we engaged them really early on, and we learned that we needed to support things like bulk filing, which wasn't something that was immediately came to mind. It was an early must-have because most employers don't file their own taxes, they pay someone else to do it. We accomplished that by, we actually helped make that process easy for them by working with the Department of Revenue to add a tax type into their system instead of building something fresh and having them log into a new system, which was an early win for the department. When it comes to benefits, different employers have different needs, and you'll want to take time to understand their concerns and then proactively reduce burden wherever possible. We came in the ethos that we're here to support, not replace leave administration in the Commonwealth. And that really helped us gain insight into how employers manage their leaves within their organization. This has led to some of the most innovative stuff that we've done as a department since going live. And Mac's been a huge part of that. So yeah, Mac, you want to talk any bit about the research that you and the team put in to understand employers?
Yeah. So yeah, like Greg said, there's a wide range of stakeholders that you do need to consider when implementing paid leave. There's healthcare providers, there's obviously the employees who are seeking leave. Insurance providers is one that I'm still learning about. Employers were one of the ones where we were mapping out how we thought the system was going to work, and it became really clear, what does an employer do when their employee needs leave in this new system, right? Because there's things like FMLA, which they might have interacted with, but this was really going to be a paradigm shift. So we decided to do some discovery research with employers. We had one-on-one interviews with them and tried to understand how they currently manage leave, how they were expecting things might change, what tools they might need when PFML became law. And just one of the foundational things we actually learned in that research is there's not a single employer experience to build for. Employers are really complicated. You have large businesses, you have small businesses. There are third-party administrators. There are also something called professional employer organizations. These were things I had never heard of before, but they all have their own workflows and they all have their own needs, and they're all going to kind of interact with the program a little bit differently. So like Greg was saying, as we were developing these tools for leave administrators, we really had to do a lot of follow-up research to understand how to make this service kind of fit their workflow.
Great, thank you for the additional insight, Makaela. That's super helpful. So it sounds like it was a team effort. There were a lot of stakeholders involved. There were a lot of people that you needed to understand needs of. The employers were involved, or the employers you learned needed to be involved in ways that you hadn't considered before. There's an importance in a sense of optimism. All of these really great things, really great advice for other states or possibly a federal program, which leads me to my next set of questions for Kathleen. I'd love to shift a little bit to the current policy landscape. So there's less than a dozen states that have a paid family medical leave program, but there is momentum in many states to pass legislation, and there's momentum for national coverage. What does the national landscape, particularly the federal landscape, look like for PFML? How close do you think we are to the reality of having a paid family medical leave program for people across the country?
Yeah, it's such a good question. I mean, I think we're definitely the closest we have ever been. President Biden ran on it. One of the pieces of his platform was having a national paid family and medical leave program. He proposed a comprehensive program. That was certainly a big part of the Build Back Better agenda that was in Congress last year. Now, as I think most people know, that effort has stalled, not just in paid leave, but across the board. And the latest reporting is saying that Senator Manchin, who is the crucial 50th vote in the Senate, has just 3 things on his list, and paid leave is not one of them. However, I think we get sometimes overly focused on Manchin and don't focus on the fact that we have a highly supportive president. The House overwhelmingly passed a comprehensive paid leave program. 49 senators embraced the idea of paid leave. We have some really important champions. Chairman Neal of House Ways and Means really championed this. We have a handful of very vocal female senators who are working as hard as they can on Senator Manchin. And so we're very, very close. It's not going to happen in this reconciliation package that the Congress continues to consider. But I think we're very close. And I do not think that I know the efforts on the federal level are not ending.
That's exciting. So Build Back Better had a particular, so that was the bill that was in question where the House passed legislation related to paid family medical leave that you're referencing.
Yes.
There was a particular model for paid family medical leave in that bill because of the dynamic of using the legislative vehicle of budget reconciliation. There's also these other models. I know there's the Family Act that's been introduced for many, many years in Congress. I'm wondering if you can share a little bit about some of the differences in the dynamics of those two bills and potential paths that they can take, and some of the challenges and opportunities with job protection in particular.
Great question. Yes. So the package in Build Back Better was very similar to what President Biden proposed. And honestly, on the benefit side of the equation, it was very close to what I described at the top of as the ideal, that it would be like Social Security. It would cover people no matter how long they're in a job, whether they're part-time or full-time, whether they, no matter what state they live in, it would be completely portable. And so on the coverage side, it was fantastic. As far as what kinds of reasons for leave it would cover, it was very comprehensive, not just the new babies and medical issues and caregiving as people are kind of accustomed to, but things like military leave for when, a spouse is being deployed and the family needs to move and find new schools and things like that. It would include what they call safe leave for survivors of domestic violence or stalking when they need to relocate and start their lives over. It was very comprehensive, very inclusive, very progressive benefit formula. It really was the ideal in many ways on the benefit side. But because it was being passed it was passed in the House and would have been passed in the Senate as part of a special fast track procedure called budget reconciliation, anything that you do through budget reconciliation has to actually do something to the budget, whether on the tax side or the spending side. So all of that was on the tax and spending side. The problem is you can't require employers to actually let their employers go. That's not a budget issue. So that would have required 60 votes. And there simply were not 10 Republican votes plus, or there were only 49 Democratic votes to do any of this, let alone the job protection part of it. And so that was an important part that was missing. The Family Medical Leave Act, which was passed in the 1990s under President Clinton, that does provide job protection to about half the workforce when they need to take family medical leave, but many people are left out. And then of course, some state programs, if you're lucky enough to live in one of the states that offers paid family and medical leave, then you would also be protected. So a large fraction of workers would be protected, and they would be able to go back to their same job, the same pay and everything when they finish their leave. But it just was something that just required more votes that just weren't there.
Thank you, Kathleen, for explaining all of that, because I know I've had conversations with people about how they were following along with the paid family medical leave and then assumed it was job protection in the Build Back Better, but because of the dynamic, it was a little tricky. So thanks for explaining all of that. So we've been talking a lot about policy and implementation so far. And I'd love to know, Tameka, from you, as the conversation around paid family and medical leave programs continues to gain momentum, what should policymakers and program administrators and even advocates keep in mind from your point of view?
From my point of view, it's important to remember the stories. Remember the stories of the individuals that are being impacted by there not being a plan. I know that they look at data all the time, but I want them to remember that, the stories of those individuals who have faced so many barriers already, barriers that already existed. And it's just important to remember remember us when you're making decisions, making sure to do things with us and not just for us. That's something that's just really important, to not say like, oh, we did this for you. No, do it with us. Bring us into the rooms. Let us share our stories. Everyone doesn't have a seat at the table. So for those advocates, because everyone doesn't have a seat at the table, it's so important that when we do have the opportunities that we share, we share our stories, we share our souls with everyone, so they know the importance of what it is that we need and how we've been impacted. And so that's the biggest thing that I would like to share, but also that we've already been waiting so long for policies to help bring us through. We've already been waiting so long, and we can't continue to wait. We can't afford to wait. And so it's now time to move with a sense of urgency to help all Americans, because you never know when it's going to be you. It's about medical. It's about our medical health. It's about our mental health. It's about all of that. And so that's what I would say.
Thanks so much, Tamika. And I'm so glad you brought up the importance of remembering stories and this idea of doing things, creating things with the folks that are affected and not for the folks that are affected. It's making me think about human-centered design in developing services. And I was wondering, Makaela, if you can tell us a little bit about the implementation, how you've used human-centered design approach in some of the implementation challenges with Massachusetts to design with end users, design with various different stakeholders to achieve impact.
Yeah, and thank you so much for that, Tamika. I am happy to share one particular story about kind of how we tried to approach this. Something that's not really unique in state paid leave legislation, but in my kind of experience now in research is kind of different than in the private industry, is that if you give birth, you generally qualify for both medical and family leave. And each of these have separate leave allotments. So recovering from childbirth can be considered a serious health condition that is part of medical leave. And then you also have the family leave. Unlike some other states, though, Massachusetts was pretty unique because they leave the amount of medical leave for pregnancy or childbirth recovery up to the healthcare provider to determine. So, your doctor might say you need 12 weeks, for example, of medical leave, and then you have an additional allotment for family leave to bond with your child. It's just not the most straightforward policy to navigate. And so we did prioritize doing some research early on with parents to kind of see how they would navigate applying for leave, given this kind of dual application process. And from that research, we did get a lot of kind of good feedback about this and how we could kind of in plain language explain how the program works and surface eligibility to people who give birth. But one of the other things we learned in that research, which it's not actually as surprising in retrospect, but most parents wanted to apply for paid leave before their child is born, right? Because it's an incredibly stressful time. There's so much to do, and you also know in advance, unlike most other kinds of medical leave. And so we shared this insight with the policy team, but we actually had to brainstorm to figure out how we could do this, how we could let parents apply before birth and still satisfy the regulatory requirements, which said that an application isn't complete until you have shown proof of birth. So in the end, we were able to actually figure something out thanks to the really innovative policy team. And we went live with this, and Massachusetts actually became the first state in the country to allow parents to apply for paid leave before their child arrived. So I think that was like one of the really nice ways that we were able to kind of meet the user needs from the get-go. I will say that I think having more people, if, for example, other states or a federal program comes about, having more people with lived experience in the teams themselves can really kind of also augment these kinds of conversations. And yeah, just getting more people, whether they're department staff, vendors who have the lived experience, is another way to just make sure that you are designing with and not for your constituents.
Thanks so much, Makaela. So we've actually been chatting for over 35 minutes, nearly 40 minutes. So we're gonna wrap up on our last question before going into the open Q&A from the audience. So our last question is, and this is for all of the panelists. Imagine again, it's been 10 years since everyone in the United States has had access to paid family and medical leave. What's changed in our society? How do we look, work, live, and how do we engage with government? And you can choose to take on any of those questions or any aspect of that question.
So being involved in a paid family and medical leave program in a state that has it, I think our eventual goal is that you don't even notice us anymore. That we're not talking about PFML because we're successful in building it in such a way that it's not a big deal to citizens anymore. It's just taken for granted that people can be present for those big moments in their life without having to make ends meet. That, by the way, means everyone can take part in the program. I hope that PFML becomes an example of how you can ensure equitable access to these types of benefits, because life events don't discriminate. They happen to everyone, regardless of race, ethnicity, gender, sexual orientation, gender identity, socioeconomic status, zip code, whatever you want to throw in front of it. So eventually I'd like to get to a place where you don't know about the Department of Family and Medical Leave because we figured out ways to eliminate the burden on the constituent. And because of our relationships with multiple stakeholders like employers, healthcare providers, and other stakeholders, we're able to make the process invisible. That's not to say that DFML won't exist anymore. This has been a great experience being able to work with this team to be able to build something like this. And I honestly hope that a lot of the stuff that we're doing together is scaled and replicated elsewhere. So the folks that are building paid family and medical leave today in the Commonwealth are building the benefit programs of the future tomorrow. I'm really proud of everything that we've accomplished as a department, but I'm also super excited about what's going to come next.
Great, thanks, Greg. Tamika, would you have some thoughts here?
I'm excited too, Greg, because we have been at this for a long time, and I'm just ready, like even for myself, ready to come from a point of just surviving to thriving. Not having an employer who supports, you, and you not having to start over again. I really feel that we will have a happy and healthier society and a thriving workforce, a community where families are together and less stress. I don't know if it would be so much stress if you knew that you could take off work and know you had a job to come back to. And so you said 10 years from now, that's what I see, a happier and healthier society.
Thank you. Kathleen?
Sure. Well, I'd love to.
Yeah, go ahead.
Yeah, I'd love to start where I began with inclusion. And I think if we had a comprehensive paid family and medical leave system, then we'd have a more inclusive economy and a more inclusive society. And we really saw during the pandemic kind of where the pain points are in our economy and our society, that the virus hit communities of color the hardest. And so those communities died at disproportionate rates, hospitalized at disproportionate rates, missed work at disproportionate rates. And if we had medical leave, they would have been helped at disproportionate rates because they needed the help. They needed the support. They needed to be able to continue with their livelihoods. And same thing when we look at the widespread closures, they disproportionately hit, school closures and childcare closures disproportionately hit women, specifically mothers. We saw the unemployment rate skyrocket among people with low incomes and people with disabilities, whose employment rate is not very high in the best of times, and got even higher during the pandemic. And if people with disabilities were able to take the time off that they needed if they did get COVID and complications from COVID, and people with low incomes who are the most likely to go without even a single sick day. Millions of people don't even have a single sick day. And then they are, you have to take time off because your child is quarantined from school, or because you've caught the virus at your job and you need to recover. Those people, many of them were fired because they didn't have a single sick day. They couldn't take any time off. And so I think when we bring everybody in, then we have a more equitable society, a more inclusive economy, and that's what we really need.
Thanks, Kathleen. Makaela, do you have some thoughts to round us off here?
I mean, this is just like kind of echoing everyone, but yeah, right. I hope that in 10 years, this is equitable, and it means that, for every kind of worker, deciding to put your health or your family member's health first is not a fraught financial decision. It's just like something you can easily do, and you have the support of a community to do it. And I would love to see that this is really seamless, maybe invisible. And there's also probably like interactions with other benefits, like for example, WIC, so that claimants are actually getting, a full rounded safety net and all the support that they're entitled to. And I don't know, I would love to see too, like maybe this is a revitalization of care work, and really emphasizing that we could talk about things like how this relates to wages for housework, and just like putting things back that value that kind of work too, if we kind of put paid leave as this normal expected thing that people will have to interact with.
Thanks so much, Makaela, and thank you to all of the panelists. That concludes the formal Q&A moderated part of the panel. Now we're going to go to some of the audience questions. So the first question we have is, how does digital native design take into account the need to meet people where they are, in ways they are comfortable interacting, even if it is not digitally? We focus on older adults, and while many are tech savvy, others do not have internet access and or not comfortable interacting online. Would love to hear thoughts on this. So I will let anyone answer this question, but if no one volunteers, Makaela, can I put you on the spot?
I wanted to see maybe if Greg wanted to respond first.
I think maybe just to start off, and I'd love for Makaela to jump in as well. When we say digitally native, it doesn't mean digitally exclusive. Like, it doesn't mean that we're building something that only is accessible online. It means that we're using modern tools and processes to be able to develop an experience that meets people where they are. So I definitely hear you on this, and it's feedback that we hear. We do hear that folks want to be able to interact with us in a different way. The way that we've dealt with that within PFML to start is that we do have a contact center that's available with multilingual agents. We can take calls in over 100 different languages and be able to solve your problems that way. But we are still trying to figure out ways that we can meet folks where they are. And it's not just through technology.
Yeah, and I would just add, kind of what Greg mentioned in the beginning, like we launched a year ago, right? There's a lot of improvements on the way. And, we've we've heard from providers, for example, they can also often be a first contact. And so thinking about how providers' roles can support claimants, no matter their digital abilities. Also other benefit programs often have things like authorized reps, professional navigators, and there's a lot of ways to think about how the system can support like any kind of a claimant, no matter if they can use a computer or not.
Thanks, Makaela.
Yeah, and just jumping in, the federal proposal that both President Biden's proposal and the Senate proposal would have had the new paid family medical leave benefit administered by the Social Security Administration. And a really important part of Social Security Administration services, in addition to trying to, having really robust online services and a national 800 number, is having in-person field offices, thousands of them all over the country. And one thing that the agency found during COVID, when those in-person offices were shut, is that marginalized people were left out. Those were the people who needed that in-person service the most, whether because of the digital divide or, Social Security, of course, serves older folks and people with disabilities. And so often they faced barriers to, digital access, whether because just inexperienced with it, they're not digital natives if you're 75 years old, and not to say that you can't learn, but it's not necessarily your first way to go. And the nature of certain people's disabilities, cognitive impairments and other things, means that some people need more assistance, and that for many people means in-person assistance. And so that needs to be, we need to make sure, as Greg said, that we have multiple modes so that different people can get what they need. And some people are really going to prefer an online service component. And in fact, over half of retirement claims at Social Security are filed completely online. But we're also going to need to have an in-person and a phone way as well.
Thanks, Kathleen. Great. So let's move on to another question from the audience. If federal paid family medical leave was approved to roll out in 2024, what would be the first step to making sure the rollout is a success? And success could be from many angles. So I welcome any of the panelists to chime in with thoughts about this one.
I would say, it takes a while to get something started. So I think 2024 is probably realistic that, even if you passed it today, you're going to need some time to get everything set up, to get all the systems in place. It's maybe more complicated than meets the eye. You're going to need time to get the word out, as we've been talking about, to get employers bought into the system and to get them up to speed so they can answer questions, because that's the first place that workers are going to go. You need to make sure that you're reaching people. I mean, California is the longest running paid family and medical leave program in the country. It's been around for about 20 years. And in the earlier years, as it turns out, it was the people who didn't need leave as much, financially better off people who were taking leave more because they were more aware of it and they were more savvy to the processes. So you need some time also to make sure that you're reaching out to people so that they know the benefit is there, the people who need it the most economically marginalized. You need to make sure that you've created the tools that are going to reach them and that they are going to be able to access the benefits. And it just takes time to do all of that stuff. So I think you need to do really careful preparation in order to make sure that you roll it out equitably and smoothly. And it does take time. And I think you're right to think that it probably takes over a year to get all of that stuff in place.
Thank you, Kathleen. I'm going to move on to another question from the audience because this is actually a question that we just didn't get to in our formal Q&A, and I would love to hear thoughts on this. Are the states with paid family medical leave sharing operational best practices? And I was going to ask Greg to maybe share a little bit about this.
Yeah, absolutely we are. It's actually really cool. There's a really a great community of practice forming around paid family and medical leave at the state level. We benefited so much from the folks that came before us, whether they were in California or Washington, New Jersey, New York. all of them had different implementation strategies, but they also were super generous with their time and being able to tell us like lessons learned across the board. We're really trying to make an effort as well for the folks that are next up. Oregon has a plan coming up. Colorado has a plan coming up. And there are a whole bunch of other, I think New Mexico has one in the legislature. And all of those folks in Delaware, actually, sorry, there's a bunch of them. And, you know, it's cool because we know the people as well, because they do reach out and we do speak pretty frequently. I forgot to mention Connecticut, and they just launched this year. But a lot of the community is growing around this to a point that I think each implementation grows upon the last one. And I think we're all really committed to making this program a great user experience, regardless of where you are in the country. Yeah, we are sharing a ton of best practices across the board.
Great, thanks so much, Greg. Moving on to another question from the audience. This one seems a little challenging to me. I'm curious what people will say. How might we expect the future of paid family and medical leave to change as the number of people with disabilities from long COVID symptoms and related health needs grows?
I can jump in here. You know, I think that is such a good example of why paid leave is so important. You know, the majority of workers do have sick time, and it's typically people get 2 weeks of paid sick leave a year. That's typical. Now, of course, we do have millions of people who don't get that, but that's the norm. And we have Social Security disability insurance for disabilities that are very significant, that are expected to last at least 12 months or result in death. Now, long COVID is usually somewhere in the huge gulf in between a cold or a flu that is 2 weeks and a disability that is expected to last 12 months or result in death and really preclude most types of work. And this is exactly the broad middle where we need paid family and medical leave. You know, paid medical leave for people with their own impairments, and paid family leave for caregiving. And so I think it's really important. I went to a conference earlier this week, actually, on long COVID and disability, and the numbers are enormous. There's, you know, an estimated 500,000 people are going to have significant long COVID or do already have significant long COVID symptoms that have lasted at least 12 months. And of course, we're 2 years into this pandemic. Over 100 million Americans got Omicron. We have no idea what it's going to look like for those people who had Omicron 12 months from now. And we know that an even greater percentage of people have lingering COVID symptoms that can be debilitating, that last, you know, fewer than 12 months. Thankfully, that's the 98% of people have recover fully in less than 12 months. But there's this huge middle in between, and we need to have some provision so that they're not losing their livelihoods. Their family is not on the economic brink. And that's exactly why paid leave is so important.
Thank you, Kathleen. And to end our session, I'm going to ask Tameka a question. So Tameka, how would your life change if you and your family had access to paid leave right now?
If we had access to paid family leave right now, you know, I wouldn't be concerned about how we're going to pay our bills. I wouldn't be concerned about how I would assist my daughter with her tuition and dorm fees through the summer. Right now, it's just, you know, my husband is in the hospital right now as we speak. And, you know, we need these protections. We need them. We needed them yesterday. But I know that our life would change because I wouldn't be so concerned about how we're gonna pay our next bills, you know? So that's what I see. If we had it now, even for what my family's going through now, you know, the challenge of getting ready to bury a loved one, and even just the mental things that happen, you know, and for family members who need to care for my uncle who, you know, his son was, they were caretakers to each other. What happens now? So I know if we had paid family medical leave, and especially if the definition of family was expanded and it was more inclusive for everyone, we would be able to support one another during this time of healing. So again, thank you all for this opportunity to share on behalf of the Voices of Workers. Thank you all for the work that you're doing and the work that you'll continue to do. And I know that one day soon that we'll have a comprehensive plan that will work for everyone. Thank you.
Thank you, Tamika. Thank you so much for sharing your story and being with us here today. And thank you to all of our panelists for enlightening us on where we are now and where we could be, where we could go in the future, where we have paid family and medical leave accessible to everyone. So I'm going to give them a little round of applause. I know we're in webinar mode and not everyone is able to do that, but thank you everyone, and have a great rest of your day.